Awesome. Thank you so much for being here. It's National Social Work Month. And we're celebrating it here at the library. We have two events. This is our second one. The first was a community resource fair that we held last weekend. It was a lot of fun. We invited our community partners out to the library to share their resources with the public. And so that's a lot of the work that we do at the library, is connecting our patrons in the community to resources. But what you're going to learn about or hear more about tonight is really the inner working of that. It seems pretty simple that someone would walk into a library, ask a question, and get an answer, but it's actually complicated, and it's something that we're always working to do, and something that we really value as part of our community service, the way that we can be a helper and connect everyone who walks in with the resources they need to thrive. So you're going to hear from our amazing panelists from the library, from the city. We're so happy you're here. Please help yourself with some coffee, tea, and refreshments. And
yeah. Thank you so much, Allie. My name is Emily Jabbour. I use she, her pronouns. I am proudly here as an MSW. I have an MSW from Columbia University, where I focused on social welfare policy. And then I went into the government. I work for the Administration for Children and Families, where I've been for 16 years, proudly working in a research office. And I am really honored to be joined in this conversation tonight about social work in the Hoboken community. I think especially lately, there have been a number of community issues and matters that have come up that have involved some delicate and complex social issues. And in my position, my opinion, I think social workers should always be at the center of those conversations, if only to be part of things at the table, to facilitate those conversations. Social workers are a key part of addressing some of our most complex needs in a community. So I'm really, really honored to be here and in the presence of people who I just simply adore and get to work with on a regular basis. So we're going to start with introductions, and I'm going to kick this off with Jennie, who's going to introduce herself. She is the director of Hoboken Public Library.
Hi, everyone. Welcome. I'm Jennie Pooh, director of Hoboken Public Library.
I'm Emily Dalton. I'm the social worker here at the Hoboken Public Library, and I'm getting my master's in social work with a focus on management and policy, and I graduate in May.
Bianca Hoffer. I'm a social worker here for the City of Hoboken. I'm also pursuing a master's degree for social work at Columbia University, specializing in clinical practice.
Hi, I'm Lori Hetzel. I'm also a social worker for the City of Hoboken.
Hi, I'm Nora Martínez DeBenedetto. I'm the head of the Office of Constituent Services. Thank you so much for hosting us tonight. We're so happy to be here.
I'm Ken Ferrante. I'm the Public Safety Director for the City of Hoboken and also the former police chief. And I was so excited a month ago when I was asked to do this. I didn't realize it was opening day of baseball, but to be here. So
but we are live streaming. This will be recorded and then can be shared later. So even our friends at Yankee Stadium right now will be able to watch this back later. So, so I want to open things up. The first question to talk about what is social work, and part of the reason that this is a big question is because I think there are a number of misconceptions about social work, partly related to the type of function that it can have, in that social workers can be such a flexible profession. But I would say that the thing I most often have encountered in my journey as a social worker is this stereotype that social workers are only trained to remove children from homes. I think there's often a common feeling that that is the only possible type of social work that exists. And it's not often the case that you kind of scratch a little bit further into the definition of social work to understand better. And I think one of the really amazing things about this panel tonight is it's folks who are engaging in social work in different ways. And even for myself, getting into politics, politics is not usually a place you find a lot of social workers either. And I'm of the opinion that there should be more, frankly. So my little soapbox speech. I want to get into a little bit more about what social work is, and I'm going to ask this question specifically of Lori and Bianca. I don't know which one of you want to go first, but what is social work to you?
So to me, social work at its core is connection. Connecting with people, connecting with community, connecting people with community, with assistance. Assistance can be anything from, counseling, advocacy, social services. It could be a number of things. But it all starts with that connection.
And I agree, just to echo, I think it comes down to advocacy for those who are most vulnerable in the community, those that need help, connecting to social services, pretty much everything that Lori touched.
So, and let's think in this idea of non-traditional social work spaces. I want to ask Jennie, why did the library decide to hire a social worker? Because I think for a number of people, I think that's kind of a surprise to find a social worker who's part of a library community. So can you talk to us about that?
Yeah, happy to. So, libraries have been the community watering holes for American society for 200 and some years, right? And we are one of the last free places where open and free and welcoming to all, right? You don't need to pay admission, you don't need to have ID. We are a safe and trusted place. And so we've actually been seeing folks of all walks for as long as our doors have been open. And so in some ways, the libraries have had a closer, I would say, pulse on what's going on in society. And we started to see patrons with more complex needs. And 2009, San Francisco Public Library was the first large system in the country to experiment really with placing social work agencies in their libraries. And they saw, just a huge impact in that, right? Because it's not that we were providing special services, but we were doing what libraries do at our core, which is serving the public. And there are needs that go beyond the training that our librarians receive, that social workers meet beautifully. And so now, fast forward, right, that was 2009, there are probably between 50 and 75 libraries across the country, certainly all the large systems that have social workers. Now, when I came to Hoboken 19 months ago already, we had a part-time social work intern, right? And I realized immediately that we, our patrons needed more intensive help. And we had that opportunity to provide that. And certainly with the board's 100,000% support, we were able to dedicate resources to hire a wonderful full-time social worker, Emily, who is just absolutely amazing in her short time here. And we have seen the impact with our patrons. So that's why I say, libraries were always evolving with society to adapt our services. People come to the library for all kinds of reasons, right? To find a book, help with job training, with technology. This is just part of our core services. So that's why a lot of libraries across the country are looking to expand this even more so.
And that leads me to my question of Emily, which is, Emily, in your role, how would you define social work? Now that we know a little bit of the context of where you work.
So my view of social work in the library is advocacy. So a lot of people come, as Jennie mentioned, for information, to access resources. So my job is to connect them to those resources or advocate on behalf of them for those resources. If they don't have access, if they're having trouble, they can come to me, I can assist, or I reach out. And that's how I developed a relationship with Nora in the Constituent Affairs office, is because I was seeing a need in the city or with my patrons who lived here. And I was able to go to Nora and say, look, I have X, Y, and Z. What can I do? Or how can we help? And so it's being the connection. And I think oftentimes people don't think that the library is a space to do that, but it makes sense that it would be once we're here, because we have information access and it's free. So.
Well, there's a basic tenet of social work that you meet people where they are at. And if people are in your library and they have needs, what better place to then find a way to advocate in that space where they are already showing up. So it's really incredible. And the work you do is amazing. I want to go to Nora next to talk about her role in Office of Constituent Services, which Emily, you teed up perfectly. What's interesting to me, I think, especially with local government, you would think that it's very accessible. I know where City Hall is. I know, where the building is, but how do I actually find the answer that I need? It can be very confusing to understand which office do I need to go to ask this question, and to navigate that. It can be very complicated. So I think one of the strengths of the Office of Constituent Services is it is your welcoming entry point, and it can be a way to navigate local government. But Nora, I want you to talk a little bit about why it is that the Office of Constituent Services is the space where the city social workers are now working out of.
Thank you for asking that question. And you know, when Emily and I were originally connected, Emily Dalton, originally connected, I was like, oh, you exist? It's amazing, fantastic. And I was only too happy to send people in her direction. And you know, I'm just so grateful that you exist here and that the Hoboken Public Library supports the work that social workers do. Because as Emily Jabbour noted, it's, you know, people walk into City Hall on a daily basis looking for help. And a lot of times it's, hey, my neighbor has an annoying tree, which I can help you with, right? But sometimes it's a need that's really, really more personal and more necessary. And the city of Hoboken didn't have the means to really meet all of that, right? So, you know, you come in and you talk to me, and I am not a trained social worker. So I would say, okay, let me help you in this moment to do the best that I can. Let me Google, let me call Emily Jabbour, let me call Emily Dalton, let me find the people who might know those answers the best way that I can. But it really wasn't, you know, the best way to do that, right? So now seeing that need on a daily basis, I felt really lucky that the city of Hoboken said, yes, we need to do this. The library is doing an amazing job with it. Let's, you know, support them, hire more social workers, bring them into the community. And I think it's been, in my mind, like a very seamless kind of addition to the services that the city is offering. So I'm really grateful to Lori and Bianca for stepping up to the challenge and meeting the needs that the city of Hoboken has. And to Emily in the library for providing the framework for us to work with.
It's, I mean, you may not be a trained social worker, Nora, but you are a social worker. Let me be clear, you are a social worker. The work that you do is really incredible.
Well, in this crowd, that means a lot. So
Yeah,
thank you.
yeah. We're very grateful for you. And it's fun, you know, in Hoboken politics, it's not often that you agree about all of the things, but I will say the city council, the mayor, the administration, we're all in agreement about the need to invest in social work professionals to support the work that the city does, which is, you know, it never happens very often, I'll say. So we celebrate it when it does. And I'm, you know, for me personally, having a social work background, I was really thrilled to see the city make this investment. You know, and getting to some of my earlier comments about some of the more complicated issues that our community is facing, a number of them have landed in the public safety arena. And so I want to hear from Director Ferrante, if you could comment a little bit about how it is that you see social work and some of the changes in terms of this landscape of resources impacting your ability to oversee public safety for the city.
Sure. What a great addition to our city. Such fast changing times in law enforcement and criminal justice. Back when I was chief, when the mayor was elected, the Saturday after his election, he called for me for a meeting. He said, what's the two biggest issues that the police department's facing in the city of Hoboken right now? And one of the two, I said, it's incredible the increasing amounts of people that are dealing with homelessness and mental health issues. And that just went up exponentially with the start of pandemic, 2020, the George Floyd murder, the feelings towards criminal justice and police after that, and there needed to be a rebooting and a reformation. A lot of people talked about utilizing social workers for helping the police. With some of the law changes that have happened and AG guideline changes in the last 3 years, when the police get called to a scene of a person being disorderly or a person in crisis, if the person is not committing a crime, if they're not suicidal or homicidal, they hit a wall. They'll call EMS, which is our ambulance service. If the person is not homicidal or suicidal, does not want to go to a hospital, they hit a wall. So as we were talking about this last year, talking about bringing social workers, so many people talked about it nationwide. Not too many people have done it. Only a couple cities out of the 556 municipalities in New Jersey have done it. So going through the process of the interviews, which Nora and I did along with Director Freeman, finding the right chemistry, bringing on Laura and Bianca, they are in here less than 2 months, and the amount of networking that's been done in so many different areas of the city to help people in ways that we have not been able to in the past. And now we have Captain Danilo Cabrera, who's in charge of the uniform division of the PD. He's our liaison in between the constituent services and the police department so that we can best utilize our social workers, because there are so many people out there in need that are not to be in handcuffs, they're not to be forced to a hospital. We've had a lot of deinstitutionalization in the country in the last 10 and 15 years. While there's a lot of great things for that people aren't in lockdown facilities, there are people on these streets that need help, and we are finally able to provide some services. Because remember, there's also a trust issue that has happened with law enforcement in the last 3 or 4 years since George Floyd. We have crisis intervention training in the county of Hudson. Hoboken Police Department had the most amount of trained officers in the county. In the last 2 or 3 years, people were just not listening or trusting and wanting the referrals. Now we have 2 professionals here that are going to provide the referrals and the services and what's out there. But the number one thing, which we've talked about, they're already doing, building the trust with the community and getting out there. And in less than 2 months, that's happening.
I also think, I mean, for anyone who works with the police department, Hoboken Police Department does an incredible job. And I think a lot of this is your leadership, Director, a community policing model. So you find police in spaces where it's not necessarily an enforcement kind of perspective all the time. You're in working together with the police department, whether it's a community bike ride, whether it's a school resource officer, you're at, maybe it's at the food pantry. You're kind of always interacting in a positive environment where people are friendly with one another. And that helps with the trust being built in this community. And I'm really grateful. Your leadership in that space has been particularly, I think, exceptional for
Thank you.
the ability to do that. I want to look a little bit more into understanding, kind of getting back to this idea of what is social work. I think a good way sometimes to illustrate that is to talk about what a typical day looks like. So for our 3 social workers up here, for Emily, Bianca, and Lori, I'm going to ask each of you to give me an example of what a typical day looks like for you in your role. So Emily, do you want to go first?
Sure. So I'm going to give 2 examples. So I'm going to give 2 days. So on Mondays, I do drop-in hours here at the library. So from 11 to 1, I sit upstairs on the 2nd floor at a table. I have my laptop, and I have a sign that says drop-in hours. And I let people come to me and talk to me about what they're going through, what they need. Sometimes people just want to chat. They just want to come in and have a conversation. But I sit and I work and listen and take notes. And then I will go back to my office and I'll start working on how to problem solve those issues. Sometimes I don't have an answer. And unfortunately, I have to go back to them and say, I can't fix this. But my work ethic is that I will never leave someone without an answer. So even if I don't have an answer, I will say, I can't do this, but this agency can, or hopes can do it. So that's like my Mondays. And then on Wednesdays, we do outreach visits. So we've established partnerships with St. Matthew's Lunchtime Ministry and the Hoboken Shelter. So I go with my colleagues, Nat and Allie, and we set up a table at these spaces, and we bring this tablecloth, and we bring books that are discarded from the library. We make library cards, and we bring flyers for services. And I also do outreach there. I let people come talk to me. I talk to them. It's just a really nice community building activity. So it's my normal days.
So day-to-day looks different. We're actually in the works trying to set up a day-to-day calendar that Laura and I have been working on to kind of set it, different days to do different things. We do a tabling event at the shelter with the library, which, by the way, great staff, great team to be able to work with and table with them. We always have our flyers out as well. On every other Tuesday, we've set up now to go out with the New Jersey Transit Police Department outreach. We've been doing a lot of that, community work and building that rapport, like Director Ferrante said. on Thursdays in the morning from 10 to 11. We also, because the library goes on Wednesdays, to do more outreach, we'll go on Thursdays to kind of try to balance that load. Between 10 and 11, we're there just helping out pretty much whoever needs help. We come with our laptops. We also have our flyers. And same goes for us. Like if we don't have the answer, we'll go back to the office and we'll dig and do the work to find what agencies are best to connect those individuals with. Because everyone has a specific need, and we want to make sure that those needs are being met.
But yeah, just like Bianca said, we don't really have a typical day. Yesterday, yesterday I was facilitating a trip for someone to the Polish consulate. So I mean, every day is different.
There's no map.
Yeah. It's a surprise. Every morning is a surprise.
Well, maybe I'll ask you, what's an example of a success that you feel like you've had in your role? Aside from a successful consulate visit, maybe, what other successes do you feel like?
That was a big one.
Can I volunteer, Emily, for this?
Yeah.
This is such amazing.
Oh,
I've about Project ID
Oh,
or just
yeah.
finding people.
So we have a program each month called Project ID, which people are welcome to come to the library and we help them get their IDs, their state IDs, driver's license. But also when they come, sometimes they don't have any other vital documents like birth certificates, social security cards. So we work with them from the ground up and figure out what they need, what they have. So one of the biggest wins for me has been watching patrons come in needing an ID. They come in with nothing, and we are able to work through getting a birth certificate, sending them to Social Security, getting them health insurance, and getting them all the way to the point where they have a state ID. And the amount of people that come back to me after however long it's been, sometimes it's a long time, sometimes it's a short amount of time, and they're just so thankful to have that little ID with their face on it and an address, and just it's so much access. So that's really one of my wins.
And you wrote a beautiful article recently for NASW magazine. If you don't know, NASW is the National Association of Social Workers, and they put out a monthly publication. And Emily had a letter about this particular program that was really moving for me. So I'm going to share it again. Just to make it's really wonderful. Nora and Bianca, do you want to talk about any of the success stories? I know it's been a shorter amount of time since you've been in the role.
Okay. So there's an individual that we were referred, thankfully, through Captain Cabrera and the police department. We've been working with him for a few weeks now, and he is by the ferry. Some may have seen him in Uptown. We built a great rapport with him. He is just looking for some help, right? So we've been able to contact family members and keep in connection with them. We were successfully the other day able to put him on the HHA list, the housing list.
That's great.
And we keep in contact with him. Thankfully, he does have a way to, contact us by phone, and we keep in touch, and we'll be able to help him out with other vital documents as well. And like you said, meet him where he's at, and working through continuing to build that rapport.
And we were able to find his children with assistance from Captain Cabrera at the Hoboken Police Department. So we're collaborating.
It's a great example of why social workers are so great at the municipal level, right? Because we have the resources to work together with the Hoboken Police Department and their database to, connect people. This guy hadn't talked to his kids in years. And so they, Lori and Bianca were able to gain his trust, make that connection through help from the HPD. And like all of those things together are what makes it successful. It's really an incredible story.
There's so many different communities within the people experiencing homelessness in Hoboken, whether it's mental health issues, poverty issues, just down their luck, bad luck, health issues that got them unemployed. Everybody has a different story. And the key thing is going out there and having our social workers make the contact to find out where you're from and how'd you get here. Everybody has a different path that brought them to our community. In fact, they're going to, Laura and Bianca will be doing a walk around with Hoboken PD very shortly, because it's very important to go out there and go to different spots in Hoboken where we have a large amount of people, and let's find out their story and try to make connections.
So maybe this is a good question to put back at you, directors. So what impacts are you seeing? These are individual success stories. These are anecdotes. for in your position of things, what are you seeing as how this is shifting the way that, we are working it as a local government? And what is the sort of barometer for success for you in overseeing some of this
I
process?
think I sort of do two different positions. The last couple of years I was chief, while we had this expansion of the amount of people dealing with these issues, police officers were hitting a wall. And then I would get the emails or calls, why aren't the police doing anything with these people in this area, this person in this area? Coming in as a director, Nora and I last year were getting so many emails and calls, especially during the summer, and we're saying, what can we do? And we would try to come up with answers to give to the people that are seeing these problems in the community. Now we have our professionals that, okay, we have this issue. Let's go and make a connection, and they're making the connections. That's the key. So, as Chief Aguirre said in one of our council meetings, our two new professionals and our library professionals, they're not going to end homelessness in Hoboken. However, we're going to make a lot of connections and help people in a better way than we've been able to prior to this year.
Yeah, just to follow up on that, Director Ferrante is correct. Like we both get a ton of emails saying like there's a person who's dealing with homelessness and what can we do? And we didn't really have a path forward for that, right? And listen, this is not a crisis that's unique to Hoboken. This is not something that we are the only people who are dealing with it. This is across the country, but Hoboken is unique in that we are meeting this national moment and choosing to move forward with it to help, the neediest among us. And that's something that not every municipality is doing. There's only one other municipality in New Jersey that we know of who's doing this, and that's Newark. And Hoboken is the only other place. So, no one, everyone at City Hall gets nervous when I talk about defund the police, but that's what this is about, right? It's about creating a place for these services to exist. It's not about taking that away. It's about making sure that the correct resources exist in a community, right? And that's what Hoboken is doing. And as someone who works here and someone who lives here, it makes me very proud of this.
Hoboken likes to lead the way in a number of things.
That's what we do.
Leading the way again.
And the credit to the police one with Chief Aguirre and Captain Jabbour, they embraced this. When we first brought them,
100%.
we're going to do this. And people were talking about it, but we're actually going to do it. They embraced it because they know their officers are hitting walls so many places. And now they were able to break down the wall because we have our own professionals that we can turn to for help.
Absolutely.
That's right. Jennie, I'm going to ask you a similar question. How do you see this impacting how the library is working in the community, your management of overall programming? How is Emily's role changing the landscape for you?
I mean, the library, you talk about trust, right? And I think what makes the library such a beloved institution in America is that we are a trusted place, right? People come here, it's safe, it's trusted, and usually it's warm or it's cool in the summertime. So what Emily has done in her short time, even not yet in full-time capacity, is to augment that feeling, right? And by us going out into the community, lunchtime ministry is taking those services on the road, right? And then together with the city is to ensure that we are truly serving all the needs of our community. But Emily, she's very humble. What she doesn't talk about too is, maybe there was a later question, she's also been working with our teens. As we know with COVID, that's really hit our youth hard. Mental health has, all of our youth have struggled. I mean, I have 2 kids, they went through virtual schooling, not seeing people for a while. And, Emily has come in and created programs. I can see doing a lot more of that outreach that together with our other library staff, we're able to meet those needs in a more holistic way, meeting people where they are, right? And accepting, and then trying to make sure that we are serving, especially making our most vulnerable, our most at risk folks in the community, and making sure that they get the resources they need to help with the need.
That's wonderful. And what have been success stories for you that you would, if you were to talk to somebody else, you know, a library administrator in a different place,
Oh
talk
my
about
gosh.
the success of this program, what would you say first?
Well, I'll say, 'cause I love stories, and then, you know, I hear all these stories. You know, at Lunchtime Ministry, I was honored to tag along with this great team, right? And you know, there was a line of people going, "Where's Emily? I need to see Emily." And so I'm tagging along. What's going on here, right? And she's dealing with them, and I was talking with the man who was in line. I said, "So, can I help you with something?" And it was, no. I wanted to thank Emily because she gave me free bus tickets, and I went on an interview. I'm trying to look for a job. I'm currently staying in the shelter, and I just wanted to thank her and tell her how my interview went. I mean, I almost cried. I was like, yes, please tell her how the interview went. So we talked about that. It's those little moments. That's the impact I'm seeing.
Amazing.
That's nice. It's nice to get to do that work. It's like, it makes you feel good.
I'm so, I'm so honored to say I'm with her.
Yeah.
I just want her vision.
Amazing. I want to look a little bit more at the interaction for you all on the municipal side and then with the library to better understand. I know there's a timeline issue to some degree in terms of how everyone's working together, but can you give me an example of how it is that you've worked across those boundaries? Because I would say one of the things that can be challenging at times is how siloed different institutions can be. And sometimes, you know, even though City Hall folks may have worked there for years and years, they don't know who to call over to the library necessarily to access information. And now one of the things that I think has really benefited is just open lines of communication, that the work that's happening in this building is complementing things happening at City Hall. But could you give me some examples of where that partnership has really been successful so far?
Yeah, I can give one very specific example was that I've been working with a patron since I met him in October. He came in, he needed help with unemployment. And we filed for unemployment and kind of just waited. We waited to hear back. He didn't have a phone. He barely had email. So I was kind of the liaison back and forth between him and welfare, or unemployment rather. And then I started working with Bianca and Lori, and I was like, you know, I have this one patron that I feel stuck. I can't get anywhere. I keep calling the offices, the welfare offices. I'm not getting anywhere. I need help. And Lori was like, oh, we just had a meeting yesterday with someone from unemployment. Let me contact them. And so I gave Lori my patron's phone number, and within 2 days, he got his card and his money from unemployment checks that were backed up since November.
That's great.
It was a really like easy snap.
Yeah.
Seconds. When you hear the panelists saying,
Amazing.
wow. You know they come with great work.
Amazing. There you go.
And he was in an apartment, and he was in the shelter up until January. He's now in an apartment, and he has this money. So it just, everything worked together. And it was because I was able to say like to them, I have this problem. How can you help? Or not even how can you help? What can we do?
Yeah.
And it worked magically.
Amazing. Any other examples?
Similar example now, it's like so many people have matched in, like we keep track and we're like at over 100 at this point on our sheet of like just interactions with patrons. But the one that rings a bell is the individual who we were helping him get the date for his appeal for his SNAP benefits. He was hitting a wall, he didn't know who to contact, and I was able to work with Emily directly, you know, on a day if she's not here, like I'll, you know, make the contact and reach out to the specific office, because we did meet with the directors over there. And it's always great to be able to just kind of move up the ladder and just say, hey, we're not getting a response with the caseworker. Where are we at? You know, he needs to know this date, and we got his date, and I would surely call him to remind him.
Yeah.
Anything you want to add, Lauren?
I mean, Emily, she laid the blueprint for social work in the city of Hoboken.
Absolutely.
She welcomed us with open arms from day one. I mean, it's just been seamless. If we don't have the answer and we ask Emily, she knows, she either has the answer or knows someone that has the answer. It's just such a great relationship, and I'm just so grateful to be working alongside you.
I definitely think when I heard that the city was hiring social workers, my first instinct was like, okay, I have coworkers. Like I have other social work coworkers.
Yeah.
And because I love working with Nora and going to Nora, and then I loved having other people who are doing the work with me, that I feel, even though we're in different offices and technically different companies, but we're all under the same umbrella. And I just feel like we work together so well. And the fact that it's only been 2 months is wild, because it feels like it's been
Feels longer.
a year.
Yeah.
Working together.
You know, what you're seeing here is zero ego, zero. They are doing the work, and that's all that it's about. And it's been like that from the first day, and just like lifting each other up and supporting each other in the best way that we can. And I've been so amazed, you know, when Lori and Bianca started, they were like, what, you know, what should we do? I was like, I don't know, do whatever Emily tells you to do. Like, you know, she seems to be like, you know, knocking it out of the park every day. So she used a baseball analogy today.
Yeah.
But, you know, it's and it's just no one is like, oh well, you know, he's my patron, or you know, I helped him first, or I'm getting him his SNAP benefit. You know, it's been so seamless, and I'm so grateful for this partnership, because it's just been, everyone is learning from each other, and it's been really humbling for me to watch.
And there's been no limits, there's been no limits to what they'll handle. Listen, a couple weeks ago, we had a water main break in this city. For
That's
3
right.
days, there was a water crisis.
That's right.
Fortunately, it was not a tragedy, but there was people in crisis of needing water. What can they do? Was it being, with the amount of complaints that came into myself, Director Freeman, Will Montez, being able to turn that to Nora, and then also have her team be able to help people in ways we haven't been able to do in the past.
Yeah,
It was awesome having worked with the three of them and being able to pass things on as we're doing other things. It was great.
That's right. Because you never know what tomorrow is going to bring.
Not a stretch.
Yeah. It is always
absolutely.
a surprise. And
Yeah.
I think this is part of the city's preparedness plan, I think, in a lot of ways, because you have to be able to pivot quickly. I mean, I ran for office in 2017. Did I know I would be involved in a pandemic that was going to result in having to stand up, you know, testing centers and then providing vaccinations? I could never have imagined that that was going to be on the plate of where we were headed. You know, you have to pivot. You have to be ready for anything. So I completely appreciate and understand how important that skill is to be ready.
The
for
three of them
anything.
did that with smiles for 72 hours. Really.
Incredible. Incredible.
I also wanted to give a special shout out to Ali and Natalie that also are just the whole staff, but like you guys have been amazing, and I want to give you guys like behind the scenes special shout outs. You guys
Engagement team. Yes, thank you. Absolutely. So give me a look ahead. You know, knowing that we can't always predict what's coming down that road. I'm curious, you know, especially for the city social workers. It's only been a couple of months, but I'm sure you're already kind of looking down the road as some of these pieces are coming together. You know, where are we headed? What do you think this is going to look like in, you know, 6 months versus a year? You know, what do you see coming on the horizon, either whether it's issues, whether it's initiatives, projects that the city can undertake? You know, what do you kind of feel like is coming for all of us?
So a lot of issues we've been facing, like barriers, is having the financial means to obtain whatever for clients, right? Because most of them are unemployed and they can't pay for a birth certificate themselves, or they can't purchase bus tickets or a PATH train ticket. So that has been a big barrier for us. So we're hoping to maybe create some foundations.
Yeah, there are some things, it's a little bit tricky to work that out with the municipal budget. So we're working on it and trying to figure out how the best path forward for that.
Yeah.
But
And just because it's not like there's not funds being available, the mayor would give it to us.
of course.
There are certain purchasing rules that a municipal government cannot make purchasing and give to somebody something, like donate a purchase from a government. So we're trying to work with the law department to come up with a fund that will give them the resources, financial, to go out and get those licenses, get those, you know, the different cards, the Metro cards.
Right.
Yeah, so we're working on it though, and that's something that.
We'll get there.
We've hit the law department already.
Sure. Well, and there's so many community organizations that do provide different resources, but not necessarily all of the resources that you need to cover all of those needs.
Exactly right.
Yeah, understood. What do you think?
And coming up, I was just gonna say, we have two upcoming events, the Women Wellness event happening at the Multi-Service Center in May. I believe you said May 20th.
May 20th, from 10 to 2.
That's great.
And then we also have the senior programming event, which is happening every Thursday in May
Oh, that's great. And that's going to be something at the multi-service center for
as
seniors
well.
and different kinds of activities or just.
The focus is on like mental health awareness for seniors.
Oh, great.
And so there's going to be a couple of different things that we're, looking to bring in, like different kinds of therapies and stuff like that to kind of just make it, brighten their day and bring some awareness to that. And so, I think that the programming aspect of it is something that we're kind of still trying to figure out.
Mhm.
But these two events are us dipping our toes in the water there. So
Amazing.
yeah, the women's wellness event I think is going to be really exciting. The focus is on getting underinsured and uninsured women to get mammograms. So they'll be able to get them
fabulous.
that
Yeah,
day.
great. That's
So
great.
yeah, it's really exciting. So,
Amazing.
yeah.
What does the library have coming?
Oh, we have a lot.
You must say
All the time.
Yeah, we're doing, we do our project ID every month, but two new programs that we're starting is, one is, I have the community food bank coming once a month to help enroll people into SNAP. Because everyone knows that I think tomorrow, March 31st, a lot of the safety nets for programs like Medicaid, Medicare, and SNAP end. So I've been trying to tackle that the best way I can. And instead of me just enroll, or all three of us just enrolling people all the time, I have the community food bank coming once a month to come and enroll people and answer questions, check enrollment. The beauty of them is that they're trained professionals in this, and they have direct connections to the county, so they can help patrons come in. And I also will have someone from AmeriGroup coming they'll be coming once a week for the month of April. And then same for May and June, to help people make sure that they're still enrolled in Medicare or Medicaid, to get them enrolled and to check their status. So we are really trying to tackle that because I know it's going to be a big issue for a lot of people.
Those are great ideas. Yes. Anything?
Well, you talked about our programming, and we have a finite amount of time, and I talked about this. Our core, I would say, core audience is families and youth, and I cannot overemphasize the need for providing more mental health resources for our youth. And what Emily has also, once she's full time and graduated, is that Emily has been supervising some social work students, right? And this is very typical in this program. You supervise a graduate student, right? And we had someone wonderful here, so we intend to definitely continue that, expand it, because that person had been leading some of these programs with their youth as well as everything else that we're doing. Right.
Yeah, we're definitely trying to encourage interns to come to the library for their placements, because it is a space as a social work student where you can learn so much, and you can learn about so many populations, and the library has programming, and it's just, as a student, at the end of the day, I am a student still, and it's just been tremendous to my education to learn how to be a social worker in this space.
I think one thing, last thing I'll say is that it's still quite a new field to place social workers within public libraries, but I think higher ed institutions like Rutgers is definitely taking note of this, and other institutions, and being much more intentional about placing social workers outside of traditional clinical placements into communities, into cities, into libraries. And along with Nora being proud, Hoboken's only, I think, the third public library in New Jersey. I think only really the second one to have a full-time social worker. So along with the city,
Kudos to us.
Yes.
Look at us leading the way.
Director Ferrante, anything you want to talk about on the horizon for public safety?
As I've told Bianca and Lori, the unfortunate fact is come March 31st, come tomorrow, Hudson County has a warming center that every night takes about 70, 75 people from the streets of Hoboken, takes them to a shelter between November 15th and unfortunately March 31st. When that ends tomorrow night, there's going to be a lot more people on our streets needing services. I think we're going to, they're going to see an increase from the police department and the PD's liaison of more people needing services. And that's why they're doing their walk around with the PD very shortly, beginning of April, to try to find who is here, who haven't we seen in our first couple months. And it's an unfortunate reality. And it's a construction issue. They were able to make a warming center in Kearney. To this date, they have not been able to make it where it's a cooling center. So it's only a 3 to 4 month seasonal shelter. So it's about finding resources to help people try to get out of the situations they're in.
Thank you so much. I don't want to hog all of the time, so I'm curious whether any of our audience members might have questions for this amazing panel. If you want to, yes.
Hi, I just wanted to introduce myself. My name is Leah Tierney. I'm actually the second lieutenant of supplies for the Hoboken Volunteer Ambulance Force. I just wanted to introduce myself. I wanted to ask, I'm also an EMT, so I see patients regularly on calls as well, police as well. I wanted to ask specifically from Emily, Bianca, and Lori, what can I do or what can I have our EMTs do if we have recurrent patients that we feel might benefit from your guys' services?
Call us.
Okay.
We've also supplied, are you with Hoboken EMS or, okay, so we've supplied them with some flyers.
Okay.
And so, with the hope that, hey buddy, it seems like maybe you could use some services that we can provide, call this phone number. So, ideally everyone who's working with you would have those available, and, you let us know if you need more, we'll be happy to provide you with more, and just, we would love to get those referrals.
Yeah, for sure.
Yeah, thank you.
Yeah,
For the
that's
important
great.
work that you do. We're so grateful.
Yes,
Thank you.
That's great. And it's a great opportunity to meet people where they're at in terms of whether they're in
Absolutely.
crisis and need
Yeah.
services. So thank you for that suggestion. Great. Patricia?
I have one question with respect to the cutoff date. I have an extension for the emergencies with respect to the food stamp and SNAP. I've been doing this for the last 6 months. I've been doing courts also, so if you know anybody to prevent homelessness, the SFH is extended. I just reached out to the Federal woman while I was texting. The PPPs have been extended. These are all grants that you do not have to pay back. And it'll help us start educating the homelessness or the ones that's becoming homeless because they panic. And anytime in the morning when I get to court at 10 o'clock, it's jam-packed in there with people thinking their door's gonna get locked. And they just simply needed the paperwork. It was extended like 2 or 3 months ago. That would definitely be helpful because there's no eviction clause still being enforced. That's what that cutoff date is for tomorrow, 31st, to make the eviction clause back, to normal. But I just texted Assemblywoman Annette Shapiro. She said she just even Trenton. They're gonna extend it, so you can't get evicted or whatever with respect to homelessness and make food stamps. But everybody's SNAP is cut. So when they come up here going crazy, yelling at you guys, they cut the PPP snaps, which is from COVID.
Correct.
Those snaps are cut, but they still could feel free to reapply. It's best to reapply so they could go by a situation that they currently in, because they gave it to everybody. And some people went back to work and make more than the president and getting snapped. So they only trying to prevent that and make sure they get in the right hands that need it. And for those of you that don't know me, my name is Pat Waiters. I don't have a title. I've been doing constituency services from when I worked with Willie Flood and Brian Stack back in the 70s and 80s. I just think that right now, when I hear the word social worker, my son got his second master's in management social work. He's in Bergen County now. He's challenged Nora, graduated from Rutgers. I was the biggest mouth mason in the audience. But I'm so passionate. The stories he tell me is horrific. I will respect social workers to the day I die. Their job is not easy, all types of issues. And when we turn the TV on, like we seen a couple of days ago, mental illness. I noticed none of y'all didn't really reach on that aspect much. It's huge. It's huge. Always put yourself. I heard a lot of y'all say, my kids, this and that. Put yourself in other shoes. Just shut your eyes and say, what if this was in my backyard? Because when we turned the TV on, we didn't expect that young lady to go back to her school 4 years later and shoot up the school. So it's about prevention. It's about going into their minds. Put yourself in their mindset. It's about changing people's mindset before they get to that point and it escalates to them taking the gun and think that's their way of revenge, because now they don't have nothing to live for. So I know your job is hard, but don't take one thing like more than another. I heard that tonight too. Well, we gotta make sure we get the most serious cases. The most calmest person, and I went through it with the pandemic with my 19-year-old, the most calmest person that shut that door and isolate themselves, that you think is fine, and you could go work on the next person's emergency, that be the one that go cause the most harm. So my heart go out to you. I got business cards. I'm on social media. I'm at every meeting there is. I don't miss meetings. I sit on Robbie Bauer's contingency service team. One of the ones that fought because they didn't want contingency services. Before Nora, they didn't have it. And I told them, y'all need this. Because everybody ain't gonna keep going to my house robbing me crazy. Nora first started, she'll tell you, I called her 1,000 times. I'm in across the street. 2 ladies came from Sea Caucus to my job today and said the man in Sea Caucus City to see you fat lady. And I'm serious. One of them had a CNI dog. She's like, I have nowhere to go. I said, ma'am, I'm at work. When I leave, I'll help you. Because I help everybody. But what's important to you is we all was impacted by pandemic. No matter who you are, what color you are, what your race is serious. People walking around with serious mental issues, and it shouldn't be treated like they criminals or they did something wrong and they the victim. So whatever you need from me, I'm here. I will provide my services. I'm not piling no more people in my car, but I was piling my car the last 4 or 5 months, taking people to court, saving their apartments. It is good. Thank you, Danny's here tonight. They opened up the waiting list Monday on the 27th. I'm very impressed with that. So it's just a start. We got a long way to go. We didn't see nothing yet. I'm in Congress in their ear telling them, no, give me more resources. Don't cut these deadline dates off. We got to show up and show out. I ride the Trenton, I don't mind. You see? So I understand that, but those resources got to be utilized right. And we got to solve this problem before it's escalated.
Congratulations to your son on his.
Pat, we're so grateful for your advocacy. We'd love to
Yeah.
talk to your son too. Will you
Yeah.
send him to me? Thank you. Thank you.
Yeah. Right. Congratulations. That's great.
I have a question, because I've seen some selecting mine when I started, I was like,
Yeah.
something happened to myself. I had no idea what I was doing. I just had no idea what I was doing. Didn't know that there could be a social work in the library. And I was like, they're like, just do what you want. I was like, it's the worst thing you could tell me. So needless to say, come March, I tried to I was able to collaborate with the middle school and start like a little girls group there, and I've been able to see some of the girls there just because, like you guys mentioned, the youth have really been impacted by the pandemic. So I was interested in doing that. So most of the stuff that I've been doing is I guess more so clinical, a little bit of helping people with IDs, signing up for unemployment, all that kind of stuff, which I like. I'm really appreciative of the suggestions you guys have made. Has been hard as someone who's not necessarily familiar with public welfare system, trying to navigate with folks and like, so what do I do?
Yeah.
But I wanted to know about if you guys do any like one-on-one clinical like therapy kind of services, just because I know it's at least some of the people that I do get the chance to talk to, it's hard to find a therapist. And they can afford to pay, or they don't have insurance.
Right.
Not everyone takes Medicaid. If you do anything like that.
I have a great example about that. So someone yesterday, she came to the table. She was a little reluctant. We did a tabling actually with the Hoboken Library yesterday. I don't even know what day it is. Yeah. Hoboken Library, and we go on Wednesdays from 3 to 4, and we were able to kind of sit there with our laptops. And she was a bit hesitant. She came up to us. And I was able to kind of get her to feel comfortable enough. And she sat down, we started this application for housing, and then started talking to her. So, to go back to your question in the clinical sense, she ended up at the end of our conversation after crying and telling me about, the traumas that she's gone through and through her life, and me being a student on the clinical path graduating next spring, God willing, you know, I was able to provide that comfort and be that safe space for her. And in a way that was like therapy, because even though we were sitting there for, you know, the purpose of completing this application, she was still able to pour her heart out and talk about some real traumas that she's experienced, but also be very passionate about wanting to get out of her situation. And I was able to link her to two great therapeutic programs, because at the end of it, she was open to therapy, and I will be following up with her to make sure that she gets those.
And so I am not a clinical social worker. In my education, I've taken all the clinical classes that I needed to take, but I'm more interested in like policy advocacy and this kind of community macro social work. So I do get a lot of questions about therapy from clients who come in, they want therapy. What I've done is I created a resource guide that exists on one of our websites, which we can share. But I've listed mental health resources. So Jersey City Medical Center has a really amazing mental health, behavioral health center where they offer therapeutic services for people of all kinds. And if you don't have insurance, if you have insurance, so I usually refer directly there. So I think my suggestion would be to look around in your area and see who has these services available. And sometimes you just have to cold call and say like, hey, I'm the social worker at the library. Do you offer this? Would I have this situation? And then you'll either get a yes or a no, or you just go from there. It's a lot of problem solving.
My name is Hannah, social worker for the Jersey City
Yeah.
Medical Center program.
Yeah.
She worked at the jail, she's been there 13 years. All right, I'll give you a call.
Sure, question.
I don't know if I have a question or a comment, but listening to the questions that people have and also your presentation, I feel like there's a real opportunity for you to have a different impact on the community that talks about problems that people have are not problems, right? They're problems. Like to think through like how you can include that in some of your presentation. Like how do you decriminalize what's happening with people? The man that you talked about who was unemployed, when I heard that story, I heard he was a guy who had a job in his house. So I hope that there's opportunities to the many, like through meeting with schools or having more panels like this, for really for people to talk about. I guess people maybe too ready. They really want to know like what are you doing to solve the problem without really identifying that this is, like these are our neighbors. Like many of us know these people from being in the apartment or living next door or knowing what problem they have. And I think it's really it's such an exciting social change opportunity in our little laboratory that is our town. So it's been very exciting to listen to all of you talk together.
Yeah. And I'll say, I think this is a conversation that Nora and I have had, and Chief and I, our director and I have had this as well. You know, especially when the story about Panera came out and what was happening with the change to their model as a business, you know, I definitely received some feedback from residents who said, you just have to send police there. You just have to arrest them. And I had to say to them, it is not a crime to be homeless. It is not a crime to have some place that you don't have a home to go to and you want to go and get a cup of coffee and sit indoors. There's a reason people are there. And that is not a crime. And the appropriate response is not a police officer. But I know that's the challenge that I think you all have frequently dealt with as well. I'm imagining in terms of the feedback that you
I
guys
won't
had
name
there.
the cities, but we had a meeting with the four of us had a meeting with the mayor a couple weeks ago, giving an update of the first month and a half. And something I saw as chief, they are still seeing now as our new social workers. There are other cities and towns that are sending people with mental health issues or dealing with homelessness to Hoboken because they say they have great services, they're generous, and they don't violate people's rights. And that's something we made a commitment to a while ago. And it's important that we don't violate people's rights. Now, that is a big reason why we had to bring in our social workers and say, all right, because we've been welcoming, we all now have to also help these people get the right services. And that's
I mean, I'm proud of how progressive Hoboken is. I'm proud of our police force. I'm proud of the way that we respond to these kinds of issues. And, you know, there are towns across New Jersey who are putting people into Ubers and sending them to Hoboken. Who are putting people on New Jersey Transit and sending them to Hoboken because we have amazing services here, because we're providing, you know, in a way that other places don't. And that's, you know, a challenge for us. We are obviously dealing with our own set of issues here, but I mean, yeah, I mean, to your point about educating people, I send emails every single day explaining to constituents that experiencing homelessness is not a crime. Standing on the sidewalk and asking for money is not a crime. Those things are not crimes. So sending the police is not the correct response. If and listen, I'm not going to say that there's not a chance for danger, you know, and if you or your family are ever experiencing any kind of scary situation, you should call HPD. That's what I do, you know, like, and they respond. We have an amazing police department. They will respond very quickly, you know, but experiencing homelessness is not a crime. And that's been an education for a lot of residents in Hoboken in the last 2 years since I've had this job.
Sure, and I also think like these kinds of services that you'll provide show people that you can access the safety net without having system involved. You know, you can get somebody to help you to go to the Polish consulate.
Yeah. It is. It
Or you
really
can get
is.
someone to help you with paying. And I think normalizing that kind of aid in a place like a library, which is like a palace for people, could be really important.
Absolutely. Manny.
Yes, I'm Moderator. So I would like to ask a question in regards to when you approach when they speak another language, how do you do you have anyone going to be able to speak another language? See that, and as well, when you do outreach to the community, also reach out to activists and are in the community who like this and help may have a special type of relationship with part of the is that in
Jennie, those are two really great questions. So I can jump on and answer the first one. So I'm actually bilingual. I speak English and Spanish. And a lot of times we see a lot of Spanish speaking individuals that the barrier, even today, for example, I had a woman come into my office and they sent her a document that she was going to lose her benefits for SNAP. I was able to help her submit those documents and explain to her what she was filling out, because unfortunately they only sent it to her in English. So that language barrier and the fact that like I'm able to be that buffer between, you know, any questions that they may have is always really helpful.
So yes, we have met with a lot of service providers in the community at the county level. I mean, we've had contacts at the state level.
I can't even begin to think of how many
Federal.
meetings there have been.
Yeah.
So many meetings,
Just
just
the other
reaching out
day.
to everyone in the community.
I was
So
going to say, just the other day, we had a federal program come in and we were speaking with them, and they help advocate for people that have disabilities and need case managers specifically for that very long process. So, you know, I even had a client today that I met at St. Matthew's who felt comfortable enough to share his story with me, and I actually made that referral earlier today. So that's just.
but we've got an open door policy, you know, I mean, City Hall is open and we welcome anyone who has anything to discuss with us to come in, and, you know, we would love to have those conversations, so.
I think just to point out too, it's interesting, and Emily, you touched on this a bit with your education because you were focused on like policy level and systemic work. You know, to your example, Bianca, about the fact that that form only came in English, the first thing that clicked into my mind was, well, that's a policy issue. Somebody needs to reach out to that department and contact them and let them know that this is happening, that people are not actually in receipt of this information because it wasn't properly provided to them in multiple languages. And that's where social work is inherently flexible in this way that it goes at every level in terms of making differences for how people are experiencing these different systems. And like in my mind, I was like, well, I got to find out what office that is, because then I'll reach out to the administrator for that office and say, we're seeing this in Hoboken, what is happening, can you make this change at the state level? And that's why social workers have to be in all of the spaces at all of the levels, whether it's at the clinical level and you're meeting people one-on-one, or if then you're, Lieutenant Governor Sheila Oliver, who is making policy decisions about how the state is investing their resources. She is an MSW as well. So, we need social workers in all the places. So I'm going to use that as my opportunity to close and say thank you to this amazing, amazing panel. I learned a lot tonight. I thought I already knew a lot about what was going on with social work in the community. I learned a lot, so I hope you did too. And I'm really grateful that you all spent your time with us and this amazing group tonight. So thank you all.
Thank you so much.
Thank you.